Hello everyone, my name is Yairm Jalomo and I will be doing my presentation on the human papillomavirus, otherwise known as HPV. Why does this problem exist in our society? Approximately 6.2 million new HPV infections occur every year in the United States, and approximately 20 million individuals are currently infected. Some cases will go on without notice and will heal on their own, while others will need medical attention. This is the most commonly sexually transmitted disease in the United States today. How does this disease happen? HPV is spread by skin-to-skin sexual contact. What contact does that include? This includes vaginal, anal, and oral sex. Where does this happen? It occurs in all sexually active populations. The first case of HPV occurred in 1956. However, it was not until 1984 that it was linked to cervical cancer by a doctor in Germany. Because of the way it is transmitted, this can occur anywhere. What are the etiological factors? Men, women, and teens may all be affected by HPV. The more sexually active one is, the higher the risk of infection they have. The host of the immune system successfully clears most of these infections on their own. However, some women will develop fulminant diseases, such as genital warts, cervical dysplasia, invasive cervical cancer. What are the risks for our communities in the future? This is a fast-spreading virus, and at least 50% of adults will have HPV in their life. This virus spreads at a rapid rate, and condoms do not protect against HPV, which makes preventative measures even more difficult. HPV can cause cervical and other cancers, such as vulva, vagina, penis, and anus cancer. It can cause other cancers in the back of the throat, including the base of the tongue and the tonsils. There is no current test to prove if someone has HPV, therefore HPV cannot be treated. However, there are treatments for the problems HPV can cause, such as those that I just listed. How to solve the problem? The first strategy is educating the communities. Condoms do not protect against HPV. However, latex condoms do help. Because of the way HPV is spread, skin-to-skin contact, the condom does offer some protection. However, if an infected area does touch skin the condom does not cover, then one will be infected. There's also no HPV test currently in existence, so screening for cervical cancer needs to be done more often. It's important to inform the community of this fast-spreading virus and to explain to them the preventative measures that can be taken in order to protect themselves from HPV. The second strategy is vaccinations. Vaccinations are safe and effective. It's important to get the vaccination at 11 to 12 years of age, males and females. The vaccination is done in 2 doses, 6 to 12 months apart. There is also a catch-up vaccination that is recommended for males to the age of 21 and for females to the age of 26 if they did not get vaccination when they were younger. HPV vaccinations protect against cancers that are caused by HPV. Strategies used in other countries. In the UK, they give smear tests, otherwise known as Pap test in the US, to women coming in during normal visits, allowing the test to be more available. For example, if someone were to come in for headaches or a back injury, the doctors then will allow them to take a smear test at that exact same visit, allowing the test to be more available. The UK government decided to make cervical screening tests a national screening program. It meant organizing the program centrally, systematically, and inviting women for screenings every few years, and then contacting them for further tests if they needed it. Public health in the future. Prevention. Preventative measures are difficult because of how fast this infection spreads. Vaccine and screenings are 2 major preventative measures. It's important to know when to get a vaccination and how often to get screenings done. The only way to do this is by educating the community. Allowing them to know what ages and how often to get screenings done are 2 great ways to prevent HPV from causing any further damage. My opinion. HPV is fast-spreading and should be discussed in schools. It's also important to discuss vaccinations early on with physicians. It's important to discuss these in pre-teenage years. Allowing males and females of a young age to know what HPV is really important, and to be aware of these fast-spreading virus. Cervical screening should also be done more often. It's important to note that HPV is not curable and is not treatable. So the only way to really know if you have HPV is after the fact, once cervical cancer has developed. And because of that, it's really important to catch cervical cancer early on. And also to note that it's not just women who are at risk. Men can also develop cancer through HPV, from penis and anal cancer. I hope overall this presentation has showed you how fast spreading this virus is and how often people do get HPV. 50% of adults will get HPV in their lifetime. Thank you for listening.